practice skills as part of curricula in several of the Health Sciences schools. He has extensive experience consulting on systematic review projects and leads the Taubman Library's flipped continuing education course, Systematic Reviews, Opportunities for Librarians. Mark received his MLIS from the University of Western Ontario in 2007. Whitney is an informationalist and coordinator of the Health Sciences Executive Research Service in the Taubman Health Science Library at the University of Michigan, Ann Arbor. She has been a member of numerous systematic review teams, teaches a session on systematic review appraisal for third-year medical students, instructs on systematic review searching and information management for residents, fellows, and faculty, and is an instructor for the systematic review workshop, Systematic Reviews, Opportunities for Librarians, which is funded by Greater Midwest region of the National Network of Libraries of Medicine. Whitney received her MLIS from Wednesday University in 2004. So now I'm going to turn the floor over to Mark and Whitney.
Okay, thank you. Thank you so much. Can everybody hear me okay? Please chat in if you're having any problems hearing me. This is Whitney Townsend. Thank you for that great introduction. And we are so happy to be invited here today to talk to you about systematic reviews and to give you kind of an overview just to get started. I will stress that this is a kind of 30,000-foot overview of getting started with systematic reviews. So we're going to be giving some of the basics. Many of the topics that we'll be talking about today could really warrant full webinars on their own. So we'll really be touching on the basics, and we are happy to answer questions. And at the end of the presentation, we'll have a number of slides with additional resources for you to explore, both online resources, training opportunities, traditional books, all that good stuff. So definitely check those slides out at the end when this webinar is over. So I'm going to go ahead and get things started off, and then Mark's going to pick things up a little bit later to talk about some of the roles that librarians take in systematic reviews and some of the nuts and bolts that we need to know about and need to be prepared with when we work on different systematic review teams. So the overview that I'm going to get started with is to talk about first why many of our partners are doing systematic reviews. So why do we do systematic reviews in the first place? And then move into a brief overview of what systematic reviews are, especially as there are many different types of reviews that may be called systematic starting to emerge right now, which is kind of muddying some of the landscape a little bit. And then I'll give some of the basics to consider when planning a systematic review. So after you get that contact from a first partner saying that they're interested in doing this kind of project, what are some of the things that you need to think about and be prepared with as you get started? So before I even start with more slides and more talking and things like that, I just wanted to get a quick idea from everybody that's here in the webinar right now, what your experience level with systematic reviews is right now. So feel free, go ahead and in the chat bar there, you know, A, everybody's asking for them, so you got to get up to speed. I think many of us are in that situation. You're interested in them but haven't done one formally as B. C might be that you've done a few. D, you've participated in many and are fairly experienced. So far I'm seeing a lot of A's and B's coming through. So people are asking for them and people are definitely interested in them. Looks like we've got a few people that have done a few or participated in many, so that's great. Okay, wonderful. Thank you all. We're happy to answer questions through the presentation. It might be a little bit easier just in the interest of time if we can hold some of the questions until the end. We'll definitely have plenty of time set aside to answer questions then. All right. So great, so we've got a real diversity of experience with systematic reviews in the group, which is outstanding, and I think pretty representative of our fields overall. So I think before we even talk about what systematic reviews are and some of their defining characteristics, I think it's important to understand why they matter. Okay, so why do a systematic review in the first place? What are they for beyond a faculty member or a student who's interested in getting published and doesn't want to go through and do a primary study? Occasionally we have partners that think that doing a systematic review will somehow be easier than doing primary research. And I think everybody that said that they've done these before is probably laughing right now, because you know that that is far from the truth. They are very time and resource intensive. So when we talk about why to do a systematic review in the first place, I think it's important that we think about primary, secondary research, but at the end of the day, the problem is, I always like to use red wine to illustrate this question of systematic reviews. So the problem isn't red wine in and of itself, but if we want to look at the effects of red wine specifically on health, one of the problems is that we hear in the news about different studies all the time on this topic. Is red wine good for your heart? Is red wine bad for your heart? What are the health effects? Is it good for blood pressure? Or is it bad for blood pressure? And we certainly see this come through in the popular media all the time, just differing reports, different answers depending on the study that you look at, and it really makes us question, so where do we stand given all of this information and all of this research? So we see this borne out certainly in the media, but we also see this borne out in the primary studies, so in the literature. Mark and I, because we come from a health sciences background, will certainly be offering up some health sciences examples here. But I think as many of you are involved in the social sciences, of course, you'll see that there are a lot of parallels between the different study types. So in this example, doing a quick search in PubMed, just looking at red wine and blood pressure, so its effect on blood pressure, we can very quickly find 3 different primary studies that give us different answers. So in the first, we have that red wine decreases systolic and diastolic blood pressure. The second says that red wine does not lower peripheral or central blood pressure, so it keeps things the same. And in the last study, we found that red wine and beer elevate blood pressure. So when we're looking at all these different studies and different results, it can be challenging to figure out what the answer is, if there is a the answer at all. So when we talk about doing a systematic review, really it comes down to we want to summarize the available evidence on a particular question and attempt as best we can to answer that question based on the evidence that's presented. And when we talk about the evidence, not just a single study, but multiple studies on the same topic, and weighting those studies depending on how large the populations are, what the quality of the research methodology is, and things like that. And so we see systematic reviews being used in a variety of settings and for a variety of different reasons. So oftentimes they are used to make policies because they're collecting and summarizing available evidence. They can identify areas where further research is needed if it's difficult to make a determination of the answer. We see them used all the time for decision making, which is closely related to policy making. Certainly in our case in medicine, it's used in medical decision making frequently, making decisions about patient treatment, things like that. In the social sciences, certainly using different types of programs, testing their effectiveness of all different kinds of interventions. We see systematic reviews being useful there a lot. And so we see them in a lot of different areas that we tend to work in a lot as librarians and informationists. So we do a lot of work with people doing writing up grants, grant proposals, things like that, various research projects. Occasionally student projects will attempt to incorporate a systematic review component. All different ways and places that systematic reviews turn up as an important part of the research literature. So we know why we want to do a systematic review. We have a specific question that we're interested in answering and summarizing the available evidence. So now we come to what is a systematic review. And there are a number of different definitions out there, but there are a few things that they agree on. So we'll take a look at that real quickly. The Campbell Collaboration is one of the oldest and most well-known of the groups that regularly conduct systematic reviews. We'll see a few others, including Campbell, Joanna Briggs, just to name a few. But Cochrane was really one of the first organizations that came together and said, these are research publications that we want to start conducting to answer very specific, in this case, clinical health questions. So how to treat patients, looking at different types of interventions. So the Cochrane Collaboration defines a systematic review as attempting to identify, appraise, and synthesize all that evidence that meets pre-specified eligibility criteria to answer a given research question. Okay, and we can see why they conduct their systematic reviews and the importance of very explicit methods. And really what they're trying to do is minimize the bias that comes from having a single study, okay, to help inform decision making. So in a practical sense, what this ends up looking like is kind of a layered effect here. So on this particular topic, this Cochrane review was looking at knee-length compression stockings versus thigh-length compression stockings for the prevention of deep vein thrombosis or blood clots in postoperative surgical patients. So the question they're trying to answer is, which is better? Which should we be using on our patients, the knee-length compression stockings or the thigh-length? So you can see in the bottom that through their process, they identified 3 different primary studies that looked at this particular question, and they pulled these 3 studies together, pooled the data that was produced from these 3 studies, and reran a statistical analysis upon them to come up with their actual results in terms of which type of compression stocking is most effective in preventing those blood clots. So rather, again, than looking at a single study, they're able to get more statistical weight by looking at multiple studies on this topic. Now, I also mentioned the Campbell Collaboration, which I would imagine many of you are already familiar with. So Campbell conducts a lot of the social sciences type systematic reviews as well as others. And you can see that in many ways their definition of what a systematic review is quite similar to Cochrane's. They use transparent procedures to find, evaluate, and synthesize the results of that relevant research on a particular question. Again, they note that the procedures and the methods are defined in advance. The studies are screened for quality, and they also note that peer review is a key part of the process. So the information as well as the methods of their review are overseen by qualified independent researchers. So they want to make sure that everything is transparent, everything is done in a methodologically appropriate way. So you can see from these two there that theme of finding all the literature, appraising all of the studies, and then summarizing and synthesizing the results of those studies are kind of the themes that run through that really make systematic reviews a unique form of secondary literature. Now, I did want to stop for just a second because there's a lot of confusion over the terminology of what systematic reviews are when we actually use that term. So from a methodologic standpoint, we can see some of those primary characteristics, okay? But because systematic reviews originally really started to come to bearing in the health sciences field, when people use that term systematic review, it oftentimes has a very specific context. So for a long time, to call something a systematic review, it would need to be a qualitative systematic review, which is a qualitative summary of quantitative data. So primary studies that produce quantitative data, quantitative results that may be summarized in a narrative or qualitative fashion. Or a quantitative systematic review, which is a quantitative summary and synthesis of quantitative results. And you'll often hear those called meta-analyses. So that's actually pooling the data and rerunning that statistical analysis on it. And then we sort of have this other category of other reviews, and that might include narrative reviews, scoping reviews, realist reviews, metasyntheses, metaethnographies. We're getting a lot of different names for different types of reviews. And for a long time, we've sort of clung to this, a real systematic review is either a qualitative systematic review of quantitative results or a quantitative systematic review of quantitative results. But I think we've seen the landscape on some of this terminology starting to shift. And I will say that certainly when I started doing systematic reviews, I had a fairly rigid view of what they were and what the requirements were, very focused on interventions specifically. But that started to shift a bit. And really looking more at a systematic review as its methodology. And so now oftentimes, although certainly not always, when we hear systematic review, it could include the qualitative and quantitative systematic review, the meta-analyses that we're used to. But more and more, I think different groups are including scoping reviews, realist reviews, meta-syntheses and meta-ethnographies, and some of the more structured, rigorous review types under that systematic review umbrella, and really separating them from the traditional narrative literature review that's not systematic in nature. So it's still very, very muddy. So I think it's generally worth your time to try to clarify with anyone that you're working with the definitions for these systematic reviews and get familiar with some of the different review types, which of course is a whole nother webinar right there. But we've got some resources for you certainly to talk about those. So there are a lot of different standards, both for reporting and for methodology for systematic reviews. Some of the big ones that are referred to very frequently and are very useful documents to take a look at if you're getting started with systematic reviews are the PRISMA statement, which are the preferred reporting methods for systematic reviews and meta-analyses. The National Academies, formerly known as the Institute of Medicine, IOM, also provides standards for systematic reviews. Of course, the Cochrane Handbook is very helpful if you have time to wade through a very large document. The Campbell Collaboration also has in their research resources their guides for writing a Campbell systematic review. Joanna Briggs has a guide as well, and BEME, which is the best evidence in medical education, their collaboration also has guides for writing systematic reviews. So these are really useful documents to refer to, even if you're working on a systematic review that may be outside of the auspices of one of these specific collaborations. So when we look at systematic reviews, some of the characteristics are included here on this timeline. So whether it's a qualitative systematic review or a scoping review or a meta-synthesis, anything like that, whatever type of systematic review you may be talking about, there are some characteristics that they need to have in common. And these are the things that tend to make a systematic review systematic. And that's the identification of a specific question, the development of a protocol, we'll talk a little bit more about those in a minute, a systematic literature search, systematic selection of studies, study appraisal, data extraction and analysis, and then a systematic approach to presenting the results of that particular review. So this looks like a nice little neat timeline, and it's not always that nice and neat, but there are a few key points to take note of for a review to really be considered to be a systematic review. And the first point is looking at the literature search. And this is the area that we tend to be really good at, of course, and oftentimes where we're called in to work on systematic reviews. So from the literature search standpoint, the expectation is that multiple databases are going to be utilized. So the focus here is on finding not just a few studies, but every study. And so that often means very large sets of search results to make sure that we haven't missed something. But the expectation is that we're searching multiple databases and other information sources, including gray literature sources, to make sure that we're not missing anything, published or potentially unpublished in traditional literature resources. The literature search should use appropriate search terms, which include the controlled vocabulary as well as keywords in a structured fashion, and it should be replicable. Someone should be able to look at your search and rerun it and get the same results. You should also identify any limits that you might have applied to a search. Have you limited only to English language? Have you limited by certain date range? Things like that. When we move past the literature search, we're starting to move into the territory that oftentimes the rest of the team is handling. Depending on your relationship with the team and your level of experience with systematic reviews, you may or may not be involved in some of these components, but it's important to be familiar with them because oftentimes as librarians, we end up being, in many ways, an advisor on the methodology. So from the study selection point, you want to have at least 2 people screening the results blinded from each other to reduce bias, have clearly defined inclusion and exclusion criteria, and then again we see that at the study appraisal point. At least 2 people appraising articles, assessing the risk of bias, and same thing at the data extraction and analysis point. At least 2 people independently extracting the data that's going to be analyzed using a standardized form, and then conduct some kind of synthesis, whether that's qualitative or quantitative if appropriate. And then presenting those results, usually in some kind of publication format according to accepted standards. So Prisma, IOM, depending on the field, there may be different publication standards. So being familiar with those and presenting the results in that way. So really what it comes down to, oh, my animations don't work, I'm sorry. I had wonderful animations of sheep coming in. But the really important thing to remember with a systematic review is that they need to be transparent. So you need to indicate everything that you've done along the way, and it should be replicable. So someone should, like any good research study, like any good experimental design, someone reading the report of your review should be able to go in and replicate exactly what you've done and come to the same results. So when we come to planning your systematic review, I think we all know in most projects that it's rarely a linear process, and it usually gets messy in there somewhere. And I think one of the things that can be the most useful if you're getting started on a systematic review, whether you've done many of them or this is your first one, is to come up with a plan. So more and more different organizations are recommending systematic review protocols in the same way that other types of studies have a protocol or their plan. So Cochrane certainly gives us a great definition of protocols and what they should include. And this can be useful when working with teams and letting them know that this is an important part of the process. Because systematic reviews are not linear in fashion. That nice arrow graphic we gave before is not how they go. I tend to prefer this graphic, which can be a little scary sometimes, but it really lays out the different components of the systematic review process for any given project. So at different points, there's preparation, there's article retrieval, there's appraisal, there's synthesis, and write-ups from the protocol to writing the actual review. So it's a very involved process, which really takes some pre-planning to get it running smoothly. And there are all kinds of resources that can help with this that quickly get overwhelming. So there are the different collaborations and organizations with their standards. There are different protocol templates and formats. You can Google systematic review template and come up with any of them. And it can get very overwhelming very quickly, especially both for you and your team if this is their first time doing a systematic review. So I usually tell people to just take a deep breath at this point, and don't worry. Really all you need to do with your protocol is come up with a plan for how you're going to do your review. And between all those different standards and different organizations, there's a few key points that you just need to define from the outset, depending on how formal or informal your protocol is. So you just need to know who's involved, who's going to be on the team. And what's their expertise, and Mark will talk a little more about that in a few minutes. Why you're doing a systematic review, what kind of impact is this question going to have, what is the question, what are the search parameters, which databases are you searching, are there time limits, things like that, how are they planning on doing the actual appraisal process, as well as the analysis and the writing, and what is their planned timeline. Which is a very important question because a systematic review can take anywhere from a few months, if you've got a team with a lot of resources devoted, to a few years, which is fairly typical. I also think having a protocol is really helpful to us as librarians and informationists because it helps us educate the team on proper systematic review methodology. It can help inform our search, and eventually, ideally, it leads to distribution of the work at some point. So we often take the role of educating the team members on that systematic review methodology because you've probably had the experience, if you're here, of someone coming and saying they want to do a systematic review. And so we really have to ask, do you really want to do a systematic review? Is this really the type of article that, or the methodology that you should be using for your question? And so there's a few resources that can help answer this question when you're working with the team. I find one thing that's very helpful is just to show them some of the different standards that they're going to need to comply with, or the guidelines, to make sure that they understand what they're really getting into when they do a systematic review. We've listed a few resources on here that are also helpful. Melissa Rethleson, formerly of the Mayo Clinic, has a great post on I Want to Do a Systematic Review that has some really helpful questions to ask. Also a few articles on some of the other types of reviews. So beyond those traditional qualitative and quantitative systematic reviews, what are some of the other methodologies that your team may be considering if it doesn't fit into kind of a meta-analysis framework? And so it really comes down to the suitability of the question for this type of method. So does the review explicitly address a sensible question is one of the first things that comes up. So would you expect that there would be enough studies on this topic to actually synthesize and review? Would they have similar results that you could pool together? Do you have explicit and appropriate eligibility criteria? So have they defined the population that they're interested in looking at? Are there certain study designs that they'll be including or excluding? And I think what's really important to consider also is what's the impact of this question? So who cares about the answer? Is this going to help drive policy? Is it going to help drive patient care? Will this affect practice in education, in social work, things like that? There needs to be a reason to go through and answer this particular question. And not all questions work well in a systematic review methodology. So there are some questions, some study types that just don't lend themselves well to methods like randomized controlled trials and things like that. So this article from BMJ's December issue, which is always a joke issue, about parachute use as a systematic review. Well, that doesn't work well. We don't do randomized controlled trials and give some people parachutes and some people not parachutes and have them jump. So that would be a question that would not be well suited to a systematic review method. Part of the team education is also making sure that they understand the resources that are necessary to undertake this kind of project. And one of the biggest ones is usually time. Just having the time to actually do this, having the appropriate expertise on the team, which Mark will talk about, and having access to the appropriate types of technology, which includes access to the different databases that you'll want to be able to search. Having this protocol and this plan also helps you inform your search process. Both by identifying the questions that the team's really asking, because oftentimes there's multiple questions, and making sure that the search doesn't get out of hand. Sometimes the teams want to look at everything, and everything is not a topic for a systematic review. It needs to be focused and searchable. And you can also use that time to identify the areas that you need clarification or you need to help the team clarify. So they may say that they want to look at bullying interventions. Well, in this case, what do they mean by bullying? Does that include both physical and emotional bullying, cyberbullying? How are they defining this? That's going to inform your search process. And as you're formulating your searches, doing so helps you identify the right resources, making sure that you're searching the appropriate databases, generating your search term lists, finding additional help if you need it, subject experts in other areas, and the right kinds of filters and limits that you may want to apply to your search. And finally, I think having that plan is really important, and having that protocol is great because it provides that framework for the final publication and really helps the project from getting mired down. If you're using a standard protocol format, you're already following the accepted standards of journals. So oftentimes at the beginning, if teams are a little resistant to putting together a formal protocol, I will let them know that this will make it much less likely that they will be rejected or sent back from review when they actually go to submit to the journal. And I think it sets you as a librarian up in a great position as you're helping them plan this whole project, that you are a full member of this team, which then makes it much more likely that you will be eligible and qualified to serve as a co-author on the project, which is oftentimes one of the things that we're looking for out of it. So with that, I'm going to go ahead and Mark's going to take it away and talk a little bit about some of the different roles we as librarians take on and tasks to be aware of.
All right, thank you, Whitney. Yeah, I'm Mark, and I'll be talking about systematic review teams, what a team should look like, some of the roles librarians tend to take on in systematic review projects, and certain tasks that those roles involve. In terms of teams, the first thing, so there's a couple sources that are helpful with in guiding you on what a systematic review team should look like, or the certain types of skills and expertise that should be involved in the systematic review team. One is the Cochrane Handbook that Whitney mentioned earlier, and the National Academy's guidance on systematic reviews is also helpful, and I'll have a slide on them in a second. But from Cochrane, well, from both of them, really, one of the main points is that a systematic review team should not be just one person. You should have multiple people and skills involved in the team. The primary reason for this is that, one of the reasons I suppose, is that it will ensure that at least two people are doing the bulk of the work independently, and it will help minimize biases. It'll help remove any sort of prejudice that could be brought into the study by or through preconceived notions. Just having two sets of eyes, at least, on the individual studies and making decisions related to the project can help reduce some of those limitations. In terms of the team members themselves, you certainly want at least one topic expert. That could be a clinical person, or in our environmental health sciences environment, or a suitable expert in other environments. You would like somebody who has some knowledge anyway of what appropriate systematic review methodology would be, a statistician if you're doing a meta-analysis, and Cochrane is starting to emphasize healthcare consumers, bringing in individuals without clinical or methodological expertise to the project to provide a different point of view. The National Academies, formerly the IOM, they have Institute of Medicine, that is. They have a nice document that outlines what a team should look like. They emphasize it being a multidisciplinary project, and they also call out specifically librarians and information specialists, highlighting the important skills that librarians and information specialists have that can contribute to the project. They also note that the size of the team will depend on the complexity of the topic, but both Cochrane and National Academies will come down to at least having 2 or 3 people on a team, that the team should be more than one person. So in addition to what Cochrane calls out, they mention the librarian as a search expert, and then also call out others as appropriate stakeholders or key users, not necessarily clinical or topic experts. Now, within that team structure, if you are a librarian involved in a systematic review, there's a number of roles that you can take on, and many of these roles will be outlined in the Cochrane Handbook, National Academy's document. Campbell's Method Guide for Systematic Reviews is a fantastic document outlining search strategy stuff. And then Prisma, which is a reporting standard, will highlight many of the things that should be done in a systematic review project. So these are good sources of best practices for systematic review projects, and within those best practices, you can pull out some of the key features that librarians can contribute to, I suppose. And I've broken them down into 4 main areas in terms of librarian roles and tasks: the comprehensive search, supplemental searches, citation management and writing search methods, and then there's some other miscellaneous stuff that I group under this other consideration. So I'll just walk through each of these areas, highlighting some of the tasks that librarians can take on or tend to take on. In terms of the comprehensive search, this is the core, I would say, of what the core piece of what librarians are doing in the vast majority of systematic reviews, at least in the health sciences. As Whitney mentioned earlier, one of the important pieces, central pieces of a systematic review project is that you run a very comprehensive search, that you want to err on the side of including studies, and that your search strategy is sensitive enough, big enough to capture the majority of those studies. So as the search expert, you're going to want to build comprehensive searches in multiple databases. But at the same time, you want to balance that comprehensiveness with precision. You want to find some middle ground where you're not overwhelming the team with thousands and thousands and thousands of irrelevant noise citations. But at the same time, you don't want to be too precise so that you're missing potentially relevant articles. So it's this trying to find a good balance between being suitably comprehensive and not so comprehensive that the project kind of dies out of or becomes buried under all these citations. And some strategies to balance this comprehensiveness, and you'll see this common in systematic review search strategies if you look at them in the publications. The people doing the searches will often limit their searches to titles and abstracts rather than doing open free text searches. So they might target specific fields. And if you are searching for phrases, using proximity operators when appropriate can be very helpful as well. Another helpful component for building a search, helping to build a comprehensive search, is using sentinel articles at the beginning of the project. These sentinel articles are articles that have been identified ahead of time by the topic experts as being particularly relevant to the topic and the type of ideal study that the search should capture. So if you are able to get 2 or 3 or more sentinel articles from the group, you can use those sentinel articles to first harvest terms, find terms, could be medical subject heading terms, could be common terminology, keyword terminology that authors tend to use to describe whatever concepts are relevant to the review. I should mention that medical subject headings is the controlled vocabulary that one of the main health sciences databases uses, PubMed. So in PsycInfo and other databases, there may be comparable vocabulary that you would want to incorporate into your search, and using sentinel articles can help find those terms by seeing how those articles are indexed in the database. Another big piece is identifying the core databases. In the health sciences, the databases that tend to be searched in systematic reviews and recommended to be searched through the governing recommendation bodies are a Medline database like PubMed and Embase, which gets at international journal coverage, more so at least than PubMed does. And then Cochrane has a database that they recommend you search. And then there are a series of other databases that are recommended depending on the topic. If for social sciences, social or psychology-related topics, or nursing-related topics, or more specialized topics that have well-defined journal sets, there would be other databases that you would want to search. Sociological abstracts, PsycInfo, CINAHL for nursing, whatever it happens to be. You're the expert in selecting the databases, so you want to make sure that you're selecting appropriate databases for the question. You would also want to use a combination of control terms and keywords, as I mentioned. So that would be the language or the vocabulary that the database is using to pull together similar articles, as well as the terminology authors tend to use to describe the core concepts of your topic. Of course, you want to use Boolean appropriately, so that would be the ands and the ors. Avoid using nots when possible. The more exclusion criteria you put on a search, the more likely you are to miss relevant studies. But if you are getting too many results, sometimes using nots is important. Think of many synonyms. So authors will often describe the same concept in many ways. You want to account for all of those ways, or at least the majority of the ways, to the best of your ability. And you can do so by reading titles and abstracts, looking at entry terms in the databases, and the control terms. Also avoid filters. Again, you don't want to apply so many filters that you end up losing citations that you would otherwise not lose. And one recommendation that's becoming more popular or more common these days is getting your search strategies peer-reviewed. And there's this press template that helps people peer review search strategies. So if you are able to get another set of eyes on your search, that would be a recommended thing to do, and it would look good in the methods section. And then ultimately, you want to make your searches reproducible and transparent. So save your searches, document them, and make them available in a way that somebody who's reading your paper, could be the journal editor, the peer reviewers, or ultimately the readers who are reading the published manuscript. You want to make it so that they don't have to guess at what you actually did. when you were running your searches. So try to aim towards a copy and pastable kind of strategy. So that is the database search part of it, but you should also expect to be doing other types of search related or applying other types of strategies to your searches that go beyond the typical databases. So that would involve grade literature searching, which can be or tends to be the unpublished literature. Could be conference proceedings from meetings, annual conferences, unpublished clinical trials, government reports, the type of content that doesn't tend to find its way into the journal citation databases that are most commonly searched for these types of projects. You want to hand search relevant journals. Hand searching is a process by which you would identify some key journals. It could be 3 journals, whatever journals happen to be publishing the most or more likely to publish the most relevant articles on the topic or in the field. And then you can take a look at the table of contents and go through them over a few years to see if, just as a fail-safe, a check to make sure you're not missing any relevant studies from the core associations or journals. Check reference lists as well as the cited bys, who has cited particular papers. You could do this for the studies that you include ultimately in your project. So if you've included, say you searched a number of databases, you had 1,000 citations, you whittled it down to the 5 that are ultimately included in the study. It might be, or in the analysis, it might be worthwhile to take a look at their reference lists of those included studies to make sure nothing's being missed, as well as checking the times those papers have been cited. And if you have conversations with experts who highlight particular papers, you could do that too. And you also want to make sure you reference all of this, describe this process, both the comprehensive search part and the supplemental search part in the methods section. But at the same time, a keynote is that the majority of citations for most projects, the vast majority of projects, should come from the comprehensive database searches. These supplemental strategies are just checks to make sure nothing's falling through the cracks. Citation management is another core piece of systematic reviews. Systematic review projects, in many cases or in many ways, are very similar to exhaustive searches we do in other contexts. They might be called something different. It's just a big search. But one added component to systematic review search is that citation management, data management is extremely important. It's extremely important that you're able to track all of the numbers of results you're getting from the databases, the number of duplicates you're catching, and be able to bring all of this information up at a later date if somebody asks to see the data that underlies the project. The citations are really the backbone of a systematic review, so it's extremely important that you manage the citations well. Some programs are EndNote, RefWorks, and Mendeley. These are the common ones in the health sciences anyway that people are using to manage this part of the project. And you can use these programs to export the citations into a format that will work well with the eligibility screeners, the people who will be taking your citations and making determinations as to whether they should be included or excluded. You'll want to be sure to give them the citations in a format that is suitable for them. It could be an Excel file or another file format. And the programs are very helpful at eliminating duplicates, which is extremely important when we're dealing with large result sets like we are in systematic reviews. The next step is writing, or another important component of a systematic review that librarians can be involved in if you have good, if you're well integrated into the review team, is actually writing the search methods. First, I do want to just point you to the ICMJE authorship requirements. This is the international group of medical journal editors who have agreed upon a set of criteria that authors of articles should abide by. Most key journals in the health sciences, again anyway, are adopting and adapting, in some cases, that set of criteria. So make sure that you meet that criteria. If you don't meet the authorship criteria, an acknowledgement could be the next appropriate place to be recognized for your work. In terms of writing the methods themselves, though, there are a number of places to get guidance on what should be included in a methods section. I mentioned PRISMA earlier. That is a reporting standard that is well adopted and accepted in the health sciences. But these other groups that we have mentioned earlier also have a good guidance on what should go in a methods section. Whitney mentioned protocols earlier. The search strategy should be mentioned in the protocol, either your description of what you intend to do, like the databases you're going to search and maybe some loose terms you're going to be using, or if you happen to have the actual strategies themselves you can include those in the protocol. This is just an example protocol from Prospero, which is a site that allows you to upload your protocols. In the abstract, you might need to write a brief sentence or two about what the data sources were for the systematic review. So that would include the database's search, the dates of the search, possibly any sort of restrictions on the searches themselves. This is highly variable. It depends on how much room you're able to get within the method section to describe this, and that depends on the journals. Each journal has their own word count requirement. So you include what you can. Also note that you'll have the method section within the paper to expand upon anything that you can't include in the abstract. So then within the method section itself, everything that's mentioned in the abstract should be expanded upon in the methods. You should also list the gray literature sources, any of the supplemental strategies you use to find citations. If you searched journals, hand search journals, include those. If you did the citation checks, reference checks, put those in as well. Just expand on everything you did, explain it, and make it so that somebody who's reading your study knows exactly what you did. The more you do, the better your study will look from a search angle. One requirement for systematic reviews is to have a study flow diagram. This is a diagram that will show the reader how you went from your 1,000 results at the start of your study at the start of your search to the 5 that are ultimately included in the analysis. So for the study flow diagram, the key pieces of information that you're likely going to need to pass on to the team are the number of unique records you identified in your searches, including, again, those supplemental strategies, plus any exclusions that occurred during the screening. This might be a conversation you want to have with the team, because the team whoever's doing the screening might not know that it's required to give reasons for some of the studies that are excluded. So if you can just give them a heads up at the start of it, just tell them when you get to full text screening, you're going to need to provide rationale for why the studies are being excluded. That way, they don't submit the article to a journal, and then the editors come back asking for this information, which they may not have tracked. This is an example flow diagram. I pulled it from a recent issue of JAMA. So this is the type of diagram you'll see commonly in systematic review studies. They start with the total number of results they worked with and whittled them down to, in this case, 28 studies that were included in the qualitative analysis. And then ultimately in the appendix, this is a key piece too. The journals will want, a good systematic review should have the full search strategies that are reproducible for each database in the appendix or in an online supplement or somewhere. And you want to make it so that whoever looks at it doesn't need to guess at what you did. They can just copy and paste it into the database. Some guidelines will say that you should just have at least one full strategy in the appendix, but I think as librarians we should aim towards having all of the complete strategies available for people to look at. And then just to wrap up and then open it up for questions. In terms of the other considerations, when you're going into a systematic review project, know that you will likely need to, or that's good practice, to update the search toward the end of the project. So the search part comes at the beginning of the project, right? You do this protocol, and then the first step at getting citations is running the searches. So then between that part and actually writing the manuscript, a lot of time can elapse. Whitney mentioned anywhere from like 6 months to 2 years these projects can take. So if a lot of time has elapsed, it might be worthwhile to rerun your searches and just capture the articles that entered the databases between the last time you ran the search and the current time. And then you also want to make sure that your searches are working well in each of the databases. Databases function differently, so one search strategy can't necessarily be translated entirely to the other database and expected to function appropriately. So I tend to use the Sentinel articles, pull them up in each of the databases, see how all of the databases are indexing those articles, and then build strategies tailored to each of those searches, each of those databases. And then I can use those Sentinel articles to make sure that my search is actually doing what I think it should be doing by capturing those Sentinel articles, so that you can build strategies to just test the various components of your search. In this example, I have 2 components. One's on periimplantitis and then dental cement. And the Sentinel articles in this image are search line 4, and I can see in search line 5 whether any of those 3 articles in this 4th statement are included or not in the study itself. In this case, they were all included, so I'm good. If one of them wasn't included, I'd want to take a look at that study and see why it wasn't included. Maybe I'm missing some keyword terminology, etc. This is just another example working with proximity. This is a screenshot from Ovid Medline, which is a database in the health sciences. I did a cancer proximity search of 3 within screening, and then 1 with 4, and I could see what the 69 results were that fell outside or that were captured by the adjacent 4 search that weren't captured by the adjacent 3 search. So this can help me get a sense of whether I want to use the adjacent 3 or adjacent 4. Are those 69 articles relevant or not? So final notes. Systematic reviews, librarian involvement in systematic reviews have been shown through research to be effective and to improve the methods of the systematic reviews ultimately. And there's some references there. You want to keep thorough notes. Remember that this is a research project, and people are going to need to get back to your data, or they will have that right, and we might be asking to get access to that data. So you want to be sure you're keeping thorough notes. Prioritize reproducibility and transparency. I know a lot of the time we work kind of independently, and nobody gets to see a lot of the time our work. We want to move the focus there to become more transparent, reemphasize the way we do things. If you're targeting journals for the systematic review, it's a good idea, I think, to get a sense of what that journal will want to in a systematic review. So it's good to read some systematic reviews in that journal ahead of time to get a sense of what to expect. And then there's also some systematic review software that's coming onto the scene or has over the last 5 to 10 years that is particularly helpful at screening citations. Distiller SR, Covidence, and Rayon are 3 examples that will allow you to manage citations and then help the people who are doing the screening to screen the citations in a usable, easy way. So with that, we're going to thank you and just point out that at the end of the last few slides in this presentation are the resources that Whitney mentioned earlier, and we won't go through them, but just know that they are there if you want to reference them. So at this point, we'll look at the chat and see if there's.
So while Whitney and Mark are reviewing the questions in the chat queue, I want to go ahead and thank them for this presentation. I think it's really interesting to hear from the health sciences perspective and how we can look at that in the social sciences as well. So do you all have answers to questions? I think there are just a few of them.
Yeah, regarding the Sentinel articles, we always have conversations with the faculty, the researcher who's leading the project. They tend to have ideas of what good studies are in the topic. So I'll just ask them, do you happen to know some studies that are relevant, and they can pass them our ways. Yeah, and Whitney just mentioned that if they don't know this ahead of time, they should do some homework before they approach you. So the researcher is a good source of this. There's another question about Google Scholar and replicability in terms of Google Scholar. That's correct. I think there's actually there are research studies that show that Google Scholar is not a replicable source, and I think we all know that Google will change its algorithms depending on where you are and whatnot. So Google Scholar is something we would shy away from for systematic reviews, except for the cited by feature. If you want to use it for the cited by feature, that can be useful. One of the other problems with Google Scholar is the result sets can be very large, and the types of information that you can find in Google Scholar, like PowerPoint presentations, Word documents, aren't really necessarily the type of stuff you'd want to consider. So a lot of your data might get a little muddied by searching Google Scholar, and it's not too easy to export those large result sets past into EndNote or a citation manager.
Sorry, Mark and I are trading off a headset here. On the Google Scholar thing, I did want to mention, however, that you also run into the reality of what your resources are. you know, we are at the University of Michigan, and we're very fortunate that we have access to a lot of databases because our institution is able to provide that. So when we talk about searching 6, 7 different subscription databases, that's something we can do. Not everybody is resourced that way. So I think while there are issues with Google Scholar from the replicability side of things, there's also the reality of, you know, if you don't have access to a lot of the databases that you might wish to search, then Google Scholar can provide access to a lot of those citations. So I think it's that balance. I tend to use Google Scholar as kind of a mop-up at the end to make sure that I didn't miss anything that might be important in a lot of low resource settings. And you'll see Google Scholar come up in systematic review methods not infrequently, even though there are issues. I think one of the important things to keep in mind with systematic reviews is that methodology is important, and being transparent and replicable is very important, and following good methods is key. But keeping the end goal in mind of what systematic reviews are used for is that somebody wants to be able to make a decision somehow, some way, with the information that you're providing. And so however you can provide the most information and the best information, I think that is important. Do you want me to take this one, Mark? Or? Okay, sorry. Okay, so there was a question there about the appendix. Let's see. Okay, so the search strategy where they list keywords but not specifics about how they're connected with Boolean logic and things like that. So if you've done any searching through systematic reviews, you'll probably notice that many of them are not very good, particularly from the search end. And this is, as Mark was mentioning, some of the studies that he's provided in the slides, you know, talk about the impact of having a librarian on the team, the positive impact, which means that the studies, the reviews are much more likely to comply with the reporting standards from the literature search standpoint, as well as some of the others, when we're on there. Because, you know, frankly, there are some people that are capable of doing that advanced type of searching and documenting it appropriately that aren't librarians, but it tends to be one of the things that we're best at. So, so I think it's good practice, as many of the organizations have recognized, to have someone like a librarian on the team to make sure that things are in there correctly. Let's see. Okay, I'll handle the next one and then pass it on to Mark. Sorry, we're trading this mic. So at our institution, we have a fairly large health sciences library here, and we've been doing these for a long time. Mark and I have been doing systematic reviews nigh on at least 7 years or so now, probably, possibly longer. So it's been around in the health sciences for quite a while. And so we've got a pretty good pool of people that conduct these. And we, for the most part, have been trained somewhat informally. So we don't have formal training at our university outside of the course that Mark and I and a couple of our other colleagues put on, which is a national and international course. So it's not limited to University of Michigan people. We do have an informal SIG group that meets, a special interest group locally that meets to talk about systematic review issues and things like that. So I think it's good to get together with some people that have similar interests, though, because another set of eyes is really important. Oh, I'll answer the Zotero question too, so sure. So I have seen people that use Zotero for systematic reviews. It's not something that I use myself, just because most of our researchers here tend to use EndNote, and EndNote is a bit more powerful than Zotero is in terms of handling some of the screening processes that you need to do in a systematic review. That being said, I know that there are people that use it for this purpose. So I think it just comes down to coming up with the appropriate workflow with your team for how citations are going to flow through. Ideally, when groups are screening citations, they're supposed to be blinded from each other, from including and excluding, so that can be a problem sometimes if you're working from the same, data set or things like that. If you can see if somebody else has included a study, you may be more liable to include it. So that's why they're supposed to be blinded, to help reduce bias. But I think a lot of times, again, it comes down to resourcing and what the teams are familiar with using. I've used Mendeley, I've used EndNote, I've used RefWorks, I've used a whole bunch of Excel spreadsheets for these kinds of projects. It depends on the team and what kind of resources you have access to and what they're willing to learn to be able to do this kind of project. So I'm going to pass this off to Mark to answer a couple of these other questions.
So there's a question about replicability of ProQuest versus EBSCO. Yeah, I think if you are searching, it's important when you're reporting on your searches that you mention the vendor that you're searching. So it could be Ovid Medline or PubMed or Embase.com versus Ovid Embase. So the replicability across databases might not be an issue, as much of an issue. I think if you search ProQuest, whatever it happens to be, if you mention that you searched ProQuest in the specific database within ProQuest, and you've presented your search strategies for that database, then the whoever's reading that part of your search would be able to, in theory or hopefully, get the result set that you were working on within that database, and that's the key. And in terms of other upcoming trainings on systematic reviews, I don't know any offhand other than health sciences related ones, and some of the ones that we're involved in here that Whitney described earlier.
The Margaret's webinar is free and archived.
So I think is that an MLA one?
It's free though.
So the Medical Library Association has a number of systematic review webinars that are free to access, and there was one recently by a health sciences librarian named Margaret Foster on systematic reviews, and there's a link to it in Whitney tells me that there's a link to it in one of these last slides of ours, so you can take a look at some of that. There's also some Coursera options as well. I know Johns Hopkins, this is again health sciences, has a systematic reviews Coursera course, so that might be an avenue to pursue as well. I think that's it.
Yeah, we'd be yeah, we would certainly be interested in hearing about any social sciences specific trainings that are being done in the workshop that we do. We have had some social sciences folk come to our workshop. It's designed for health sciences, but we've certainly had some social sciences people attend, and I think the interest that I see coming out of other fields now beyond health and medicine, there's a tremendous amount of interest as evidenced by your group here. So if people have questions about our development of the course or things like that, we're happy to help answer those also.
That would be great. Thank you.
Okay, so I see we've got a comment here about an uptake in synthesis reviews, including realist reviews, scoping reviews. Yeah, in some ways the reviews are getting fancier names, but I think it does represent an expansion of that title of systematic review. I actually just attended last week a workshop from a medical education faculty from the UK, who's leading that BEME initiative, the Best Evidence in Medical Education, which is kind of, bringing together medicine, but really much more focused on educational aspects. And so the presenter had some very, really interesting views on what he considers to be a systematic review, which kind of helped expand my brain, I think, a little bit on it. I'm still digesting it since it was from last week. But, one of his points was, as long as you're following a systematic process, that it could be considered a systematic review if you're including appraisal, and really any secondary data can be synthesized the same way the primary is. So if you're using textual analysis on, for primary studies and you're pulling those studies together, you can kind of meta-analyze them then by doing a meta-textual analysis. And, could we then consider that to be a systematic review? Things like that. he had interesting thoughts on realist reviews as well and scoping reviews. But I think a lot of these titles, there's still there's not solid agreed upon methodology behind many of them. The Joanna Briggs Institute, which is primarily nursing and allied health, just last year, I think either last year or 2015, put out a guide on scoping reviews since they're conducting more of them, which I've found really helpful when working with faculty and research teams to talk about what is it that do you really want to do and what article type fits the methodology for your particular question. And that article that's in the slides, there's a typology of reviews, 14 different review types that we refer people to frequently as well. All right, any other questions?
All right, I want to give a big thanks to Mark and Whitney for this presentation. I thought it was excellent. We will be posting the recording of the presentation as well as the chat transcript to the EBSS listserv in a few days. We did have a question about the slides, and I'm not sure, are these slides available as a link, or would you be able to send those to me?
So I know Mark, you probably feel the same way. Yeah, we're perfectly happy to share the slides with everyone, especially because there's a lot of links in them. So you can either distribute the ones that we sent in for posting here, or if you'd like us to send you a copy of them, we're happy to do that as well.
Can you send me a copy of them to my email?
Sure, absolutely.
Okay, thank you.
Yeah, and we just want to say thanks. This was fun. If you have questions, I know this was a really broad overview. So if anybody has questions, feel free to contact us directly. We're happy to answer questions that way. And any other questions from the group? Mark, did you want to?
Thank you.
Mark says thank you, and he's done.
All right, thank you. So if there's no further questions or anything, thank you so much for attending, and we hope to continue this conversation in the future too, since it is such a hot topic for social sciences librarians. So thanks again for attending.